Hi, and very warm welcome to Stora Aktiedagen here that Aktiespararna is hosting during 3 days here in Stockholm. As you can both see and hear, I have switched the language to English for this presentation, and I've been doing that because we have a British CEO here at stage, and it's Richard Paxman, who is the CEO of Paxman. Warm welcome, Richard. The stage is yours.
Thank you very much, and apologies this is in English. I've been working in Sweden now for a number of years and have still only picked up a limited amount of language, so I think this presentation wouldn't be too interesting in my Swedish, but absolute pleasure to be here today. Today I'm going to talk to you about Paxman. We're world leaders in cryotherapy technology to prevent or reduce the difficult side effects of chemotherapy treatment, specifically hair loss, but also more recently peripheral neuropathy, if I could say it. So, unfortunately, we've all been touched by cancer at some point in our lives. There's about 18 million new cases of cancer diagnosed every single year and growing at an alarming rate. Many millions of those patients will have chemotherapy treatment as standard of care, and many millions of those patients will unfortunately lose their hair or have side effects such as peripheral neuropathy. If you look at the US market alone, we believe there is a total addressable market of up to $600 million in preventing these difficult side effects. So, what does chemotherapy-induced hair loss mean for a patient? We understand that patients that are about to start chemotherapy really do fear most about the idea of hair loss. In fact, it's about one of the most feared side effects in about 75% of patients. We also know it's one of the most traumatic side effects, and that's because it's so visible to the patient, their loved ones, their family, their friends. We know it leads to social isolation. It really prevents a patient feeling normal and also that privacy piece. And it can affect a patient's self-image more than breast surgery. And there's even patients who will say no to chemotherapy because of hair loss. So really focusing on that hair loss piece, which is where we are really, our traction and our experiences, we've now developed technology that can prevent hair loss for patients undergoing chemotherapy treatment. So we deliver cooling through a cooling device, which is generally worn by the patient for 30 minutes before chemotherapy, during chemotherapy, and for 90 minutes afterwards. And I'll talk about how it works very shortly. Just a little bit about why we do what we do. I think that's important to understand how passionate we are. But when I was just 10 years old, my mum was diagnosed with late-stage breast cancer. She was young, in her 30s, and like all those cancer patients, didn't want to lose her hair. They offered her something called scalp cooling at our local hospital back then, all those years ago. But for my mum, it didn't work. So seeing that distress, my family started to develop technology that would work for patients in the future. So for the last 20 years, we've been developing the technology, carrying out extensive clinical trials around the world, and more recently, improving market access. And that's really with a vision to make sure no matter where you are in the world, no matter what your income, gender, ethnicity, you have access to this treatment. We've got a long way to go, but I do strongly believe that together we can achieve this. So how it works, quite simply, what we're doing is cooling the patient's scalp to around 18 degrees Celsius. What happens at those lower temperatures is we induce vasoconstriction, so restrict the amount of that chemotherapy that gets to the hair follicle, reduce drug perfusion. What you'll also see is a drop in metabolic rate, reduced cell division means less targeted effect of that chemotherapy treatment. And then more recently, we've developed our own cell culture models looking at hair cells, skin cells in vitro. And actually what we see is at those lower temperatures is less drug diffused through the cell membrane, both actively and passively. So a lot more going on than we used to think just about vasoconstriction. The more we understand about how it's working, the better we can make it in the future. We have lots of clinical data. In fact, for a medical device company, we have a great set of clinical data. Over 8,000 study subjects involved. Those are large randomized controlled trials, real-world evidence, prospective studies, and it's an inclusive and diverse range of clinical data. What we see is on average 50 to 60% of our patients are successful with scalp cooling, better with some drugs, less good with others. The alternative is, in reality, total alopecia. So this is really important for your patient population. We also see stronger regrowth even when it's not successful for a patient. So why am I here in Sweden? So our top co actually is Swedish, although I'm a British CEO. We did an IPO on the First North Nasdaq small cap market back in 2017 to fund our US growth. And that in essence is funding our UK company, which is where at the heart of the company is the majority of our people and our typical departments. We have a strong board that actually sits out of Sweden though. We have our UK company, as I said, and then our US entity, and more recently a Canadian entity as well, with the US being our fastest growth company. We have about 90 people employed in the business. That's increased from 25 in 2017 to 90 today. So we're a large organization now for an SME perspective. We have a wonderful and strong SLT, and then the typical departments you'd see in any growing organization. What's really important to me is our people. They're fantastic. They do a wonderful job. And what's important and what's at the heart of everything we do is really trying to engage with our people and making sure it's a good place to work. And through a massive amount of change, we've still managed to maintain high levels of engagement and satisfaction in our organization. And that for me is really important. So global adoption. As of today, we've got about 5,000 scalp coolers installed around the world. We operate in about 60 markets globally, varying from traditional distributor models to actually subsidiaries with recurring revenue streams, which is the most exciting opportunity for me. We've treated well over 100,000 patients. And I think what I like to draw your attention to is the United Kingdom. The United Kingdom being our original market, 98% of the National Health Service and private sectors use our technology as standard of care in the UK. We can do that everywhere around the world and make this a really exciting business. The US, our fastest growing market, and where we've put the most resource in reality. We've got about 1,000 scalp coolers now installed in 500 locations in the best cancer centers in America and ultimately the world. And we're treating thousands of patients a year, all generating recurring revenue streams, initially launched as self-pay, but more recently through insurance, which is the capital or the really growth opportunity for Paxman. You'll now also find Paxman on global guidelines around the world, as well as the NCCN. We don't mention it, I'll show the logo on here because of the cost to use it, but guidelines ultimately mean standard of care, and that's where we're heading. So onto the financials, what you're all waiting for. So I'm not going to talk about all our quarterly financials. I'm going to focus right in on Q3. Over 60 million SEK turnover, our highest revenue to date, 50% growth from the prior year's quarter, but also significant growth from the previous quarter. In addition to that, what we're seeing is a strong EBITDA. And this all really sort of works towards what we set out our vision to be at the beginning of the year, which was a profitable and cash flow positive business. We are profitable already, and we are well on our way to becoming cash flow positive, which really sets us up for the year ahead in 2024. I'd show you this graph. It's really to demonstrate that key revenue growth in different parts of the world. But as importantly, what you will see again is a stabilization in our overheads as well. So our personnel costs as well as our other costs. And that's important again to show that we can grow without those additional investments. We've got a strong team, as I demonstrated earlier. So really set for that next stage of exciting growth. We touched on cash flow positivity. We are nearly there, as you can see, just a small outflow in reality. I think it's important to understand we've reduced some of our US investments, which is capital equipment, as well as other investments. But looking at that as a timestamp at the end of September, we had at least 12 million SEK of an increase in our debtor book and a 1.5 million SEK decrease in our creditors, which ultimately will lead into some strong positive outflows in Q4. So achieving our overall target of cash flow positivity for the last quarter in the year. Revenues, I've shown you already on slides. This just gives you an idea of our US revenues, our core focus. Really good growth consistently throughout the period, with a dip throughout COVID, of course. We were all affected in that way. Looking at our recurring revenue streams is something that the company must focus on. Historically sold capital equipment, what we want to try and develop is more and more revenue streams, allowing for recurring revenue streams. Really, really supporting the growth of the business, supporting margins, and sustainability of the business as well. Those recurring revenue markets include Mexico, Japan, the US, Canada, and Spain, and hopefully other markets in the future as we develop new products in relation to scalp cooling. We've raised significant funds early on in 2017 to grow the US business from our initial IPO. But then subsequently, based on institutional investor interest in 2021 and 2022, and positive news on the reimbursement landscape in the United States, we raised further capital to really focus on growth in internationalization, reimbursement, and the launch of our buy and bill model, in addition to further research and development into peripheral neuropathy and our research centre out of the University of Huddersfield in the United Kingdom. You don't need to look at this too much, but it just shows the areas that we've spent resource on. We also reduced the debt in Topco, which we'd used to fund some of that capital equipment into the US market also. So internationalization, this just gives you a flavour of the markets that we're operating in. Still seeing strong growth, and a focus for 2024 is stronger growth in our direct markets, which include, as I said before, France and Spain, India, the US and Canada. US reimbursement has been and continues to be a core focus. We launched the business as a self-pay model, so patients paying out of pocket, on average $1,500 per patient. Now, perhaps for some of us in this room, $1,500 may not sound too expensive, but you think a cancer diagnosis in the United States, large out-of-pocket bills, you might not be working, all these costs add up. So it creates hesitancy from a provider talking about scalp cooling and offering it, but it also puts a pressure on the patient. So we've been working on insurance coverage to make sure that we take all those barriers away and actually align with our vision that it's available for all patients, no matter what your income. So we've worked with the American Medical Association with CPT coding. We've worked with CMS. We've worked with the FDA. We've worked with commercial insurers. And we're now finally starting to see the payers paying. Just very briefly how the model works. We install the capital free of charge to the cancer centre. We then amortize that over 5 years, including service maintenance and training, and then we generate income per patient of a fixed amount of $1,800 for the cooling cap that we sell. So that contribution towards fixed cost is about $1,000. So it only takes us 2 patients to pay off that capital equipment installed. So a really exciting business model with a high rate of return. In terms of where we're at from a reimbursement standpoint, these are patients, that 390, who've gone through our new buy and bill model and who we've checked their insurance coverage. What we're seeing is that 82% of the patients going through our new buy and bill model have positive insurance coverage. This is better than we ever dreamed of. Of those 320, of those remaining patients, that didn't have coverage, the 70 patients, the remainder fall into our patient assistance program, so free goods. So in essence, again, back to that vision that we have, that no matter what your income, you have access to this treatment. It just gives you an idea of our direct provider income versus our self-pay. Still early days, but growing, and some really strong growth in the last quarter. And then going forward, we will continue to work on this reimbursement piece in the US. It is quite complex, and I don't expect this audience fully to understand where we're at, but we're really moving the needle towards future insurance coverage in the US, which will unlock our growth. And then finally, as my time is pretty much nearly out, but research and development, we've got some exciting products with a topical product and a new cooling cap coming out, which will really drive that piece around consumable and recurring revenue streams, as well as enhance efficacy. And then more recently, we've moved into the space of peripheral neuropathy. So using cooling and compression to really meet this debilitating side effect, which is currently an unmet need. We have ongoing clinical trials in the United States, fully sponsored by the National Cancer Institute, and incredibly excited about this opportunity, which is as sizable as the US market, but in terms of a patient impact, has a much bigger difference, both socially and from a cost perspective, than scalp cooling. So I believe we can all make a real difference to our patients by supporting Paxman in its growth plans in the future. So thank you very much.
Thank you, Richard. Now it's also time for some questions here from me and maybe from the audience as well. And I will start off with a quick, maybe quite easy one. And I'm curious to hear about the company's connection to Sweden. And why did you choose to list here and not in the UK, for example?
Stockholm's a lovely city, but in addition to that, actually the reality is back in 2000, a VC invested in Paxman at the time. That was a great time for our business. My mum was ill at the time as well. It gave some money off the table for my father. And part of the reason they got invested in Paxman is they were doing their due diligence on a Swedish scalp cooling manufacturer. They considered putting us together at the time, but decided to invest in Paxman as we were further along. So that is the Swedish connection, and we've stayed together since. AIM is not quite suitable for where we were at from a small cap market at the time.
I see, and now we also have some questions from the viewers, which I think is amazing because I've been thinking about those questions as well. So it's very good, and we'll start off with the first one. In which year would your system for CIPN be able to receive an approval in US at the earliest, do you think?
Really good question. It's very much about what time when we want to commercialize at the moment. So ideally what we want to do is satisfy our clinical trials in Singapore, where we have the partnership, and then decide on a regulatory pathway. The reality is we can do a 510k into the US. So that's not a very big bar to cross based on the clinical data we already have. So we could say as early as 2025, but the reality is we're trying to understand the reality of sort of how much it will cost us to launch the device. What does our funding look like? Our focus must continue to be on scalp cooling at this moment in time.
And also the competition, how does that look for Paxman? Do you have any competitors?
We certainly have competitors, not many, thankfully, although we expect new entrants to enter the market based on how exciting the market is. But actually here in Sweden is our main competitor, a company called Dignitana. Some of you may know them. Great competitor, and we share an industry voice at the moment for much of our work around reimbursement. And then there's a newer entrant in the market, a company called Cooler Heads. Slightly different approach to what we are doing, a more of a mobile device, but perhaps not the right approach from a payer perspective, and uses ice and alcohol in their technology, so not quite the same cooling technology either. But yeah, big market though, great opportunities.
Definitely. And if we look at the places where your system has been installed so far, we see a lot in the UK, of course, and in the US. But is there any other market except from those two that you think are a bit more exciting at the moment?
Oh, absolutely, yeah. I focus on the UK and the US, I guess, because I have 15 minutes. But looking into Europe, Germany is an exciting market for us, France and Spain. Looking into Asia, Japan is one of our highest growth markets and ultimately provides us recurring revenue streams, which is exciting based on single patient use cooling caps. We're just exploring the Chinese market at the moment and waiting on finalizing a distribution agreement there. And then we have markets like Australia, which is very strong, the Netherlands, which I'm missing out of Europe, which is about, again, 90 odd % of usage in terms of cancer centers. So lots of opportunity around the world.
And it's also a new question coming in here from the audience now. That's great. What does the patent portfolio look like? Do you have any Now I can't find the English words for it, but I think you know
absolutely.
what
Our
I mean.
patent portfolio. Yeah, we've got a
patent,
great set of IP. So we've got intellectual property on our cooling caps themselves. We've got intellectual property on the cooling system. We've got intellectual property on our topical product, as well as our newer developments into cryocompression. So quite a diverse approach to our IP portfolio, as well as trademarks and design rights. I think what's really important to understand, though, is we're a medical device, we're highly regulated, and we've got amazing clinical data around the world. So not only do we have an intellectual property portfolio to provide barriers to entry from other players, we actually have some other really strong barriers, as well as key opinion leader relationships. So I feel that's probably as strong as, if not stronger, than our IP portfolio.
If we take a look to 2024 now, a new year is coming and time is going by very, very fast. What is the company's goals for numbers of installed systems during the next year?
Okay, so we don't put forward-looking statements, unfortunately, but we do believe we will show consistent growth. I think that's fair to say, and we've delivered consistent growth for the last at least 6 years. We will still continue to be mindful of our US installation rollout based on the high capital cost it requires, but looking forward to 2024 and maintaining a sort of positive and strong level of growth.
The last few years, they have been pretty tough with COVID and inflation and rates and everything. I'm sure you've been asked about that before, but I still want to know, how has it affected Paxman and what can you do to address those things?
Yeah, I guess let's start with COVID. It affected us all, didn't it, in some ways? We saw a real slowdown in our rest of world typical distributor model sales, where people pivoted and focused elsewhere, of course. We saw reductions in cancer diagnosis, not in incidence, of course. So that slowed down some of our growth and trajectory, which I think we feel coming out of that. But we learnt new ways of working. Which actually is the silver lining. We can do far more based in England with a strong team in England than we could have ever done before. The acceptance of how we work has actually provided us lots of benefits, so that's a positive there. High inflation, and you probably see, I'm not sure what Sweden's like at the moment, but the UK continue to have this high level of inflation. Thankfully, based on where we're at as a business, a medical device company, we're not too price sensitive, so we've been able to manage through that with appropriate price rises. Ultimately, the end customer gets those, but at this moment in time, it's not affected or slowed us down. Maybe a little bit in some markets, but doing okay. So we're still a relatively new team, that 25 to 90 people. We're learning lots, but it's exciting. There are challenges, but actually I think we've come at them in a very positive and strong light.
If we put things in a bit of a bigger perspective here, Richard, how many patients do you think you have the possibility to address in, let's say, 3 or 4 years or so?
That's a very good question. I mean, we're scratching at the surface, only a few percent at the moment. So looking at the US market, could we do 10%, 20%, 30%? I think it all depends on how quickly we can accelerate the reimbursement piece. Sadly, we don't track numbers in all of the markets, so I've got less of a feel. And I know I'm not giving you an exact answer there for obvious reasons, but there's huge potential, and I believe that we can do it.
Let's also look to 2024 a bit more. What will be the most important milestones to look after as a person interested in the company and the share?
Yeah, so biggest milestones for me, again, back to the US, and I hate to bang on about the US all the time, but it is our largest growth market, will be some key milestones relating to that reimbursement landscape. So I touched on earlier that we've got CPT3 codes, which means they're investigational. We're working on how we apply for a CPT1 code at this moment in time in partnership with our competitor, actually. And that will hopefully unlock that sort of next positive momentum with reimbursement. Then in addition to that, keep your eye out for that direct provider income, which relates to our buy and bill model. So transitioning of sites, which is key KPI for us. And then I think the CIPN stuff, so keep your eyes out on the peripheral neuropathy device, the clinical trial data that we've got ongoing in Singapore.
That's great. Then we say tack så mycket och lycka till. Thank you very much and good luck, Richard Paxman,
Tack så
the
mycket.
CEO of Paxman. Thank you.
Thank you.